This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
The survey showed that 45% of respondents said the top two most important factors when choosing an urgent care is proximity to their home as well as short wait times. Patients don't want to travel very far. They don't want to wait very long. And an orthopedic urgent care walk-in clinic is definitely a way that health systems can help to achieve this for their patients.
Hello, welcome to Sg2 Perspectives. I'm your host, Tori Richie. Today, I am joined by our ortho experts, Donnelle Jageman and LaRose. We're here to discuss the growing role of orthopedic urgent care in health systems. Donnelle, Megan, great to have you.
Hello.
Hey, thanks for having us.
I wanted to start the conversation by setting the stage. Why are health systems turning to specialized urgent care, particularly for ortho services? And how does this side of care differ from a traditional urgent care center?
When we look at our forecast, for example, to identify opportunities, urgent care and retail clinic volumes as a site of care are projected to grow over 8% over the next 10 years for orthopedic and spine services. So there is some growth here. Most of the volumes occurring at those sites of care are visits and standard imaging. There's also an urgent visits category, and we know that you can bill those as well. But for today's conversation, we're concerned about urgent care as a site of care. When we get into the conversation later, though, you'll also hear us talk about office visits because some of the models that our health systems members are using are express or walk-in clinics, not necessarily your typical urgent care. Megan, why do you think that our health systems are using this as a strategy right now?
The biggest issue is access. Access has been a challenge for organizations for years and continues today. So they have to find new creative strategies to create new access channels for their patients. And patients want their needs addressed quickly and by the right person. Studies show that up to 50% of trauma-related diagnoses can be treated in an urgent care. So rather than sending patients to the emergency department where they may face long wait times or may be seen by a provider who's not specifically specialized in orthopedics, organizations are creating these orthopedic urgent care or walk-in clinics to get patients' needs addressed quickly and by an orthopedic specialist to address those access issues.
And that's why the specialty care model works really well for urgent care in orthopedics, especially that walk-in model where you can have your specialists available to drop in on patients who come in with an acute injury during the day.
By strategically opening up these sites of care, totally appreciate how that's going to improve access and the timeliness that patients are able to be treated with their various concerns. But operationally, I'm curious, what challenges have health systems encountered when they are launching an orthopedic urgent care, and how have they tackled those challenges?
One of the biggest perceived challenges that organizations are facing is staffing. Health systems often don't have a surplus of orthopedists and don't want to take them out of their surgical or clinic time to staff an orthopedic urgent care on top of that. When we speak to our members, they're often not using orthopedists as the front line care at all. They're turning towards athletic trainers, physician assistants, and nurse practitioners as that first point of contact, and then bringing on an orthopedic specialist for a consult or to tackle on those complex cases as needed. Second to that, I would say space is also a large hurdle that organizations are facing. Health systems often have competing priorities for capital planning each year, and taking on an additional lease or even building a new facility can feel like a big ask. However, we encourage health systems to take inventory of their existing spaces and identify exam rooms and their existing orthopedic practice spaces or their urgent cares that may not be utilized to their fullest extent and utilize that as a specialty track for their orthopedic patients while volumes are ramping up and operational workflows and protocols are being developed. Once volumes are justified to ask for that bigger space, that's a little bit easier of an ask for the health systems.
And the consumerism comes in here too. One of the challenges that we face with specialty offices and access is also the distance that patients are willing to travel. In our recent 2025 consumer survey here at Sg2, 87% of respondents reported that the reasonable longest distance they would travel for urgent care is 30 minutes. That's kind of far. Most of our respondents said they prefer it to be within 10 minutes. And this is where that co-location with with existing urgent care or existing physician offices can help you meet that consumer need and preference as well.
Anything else operationally that we want to touch on? Anything related to billing?
When it comes to the location, that will also inform your billing. This can be a bit of a challenge whether you're deciding to bill as a hospital outpatient department. Maybe that's how your orthopedic clinic is currently set up, or as an office visit. One of our members that we spoke to recently bills the walk-in visits as a specialty office visit because it is co-located with their office. Depending on your strategy here, you could be billing these as an urgent care visit. You could be billing them as an ED visit if you have a separate track in your ED. So that's something to think about operationally. Mostly right now, we're seeing these models be built around specialty office visit billing.
That's really helpful, Donnelle. When I think about models that exist out in the marketplace today, Virtua's Ortho Express is often cited as a model of success. And this is actually a health system that you two recently did a case study with. What lessons can we learn from their approach in tackling the ortho urgent care space?
They're certainly using some of the things we've already talked about to help them optimize this strategy. Flexible staffing, certainly. They're sharing staff with their existing ortho clinic because it is co-located. That's why they call it express care. They're using some of their office staff to supplement for their walk-ins. They're using athletic trainers and they're optimizing wait times for patients. They told us that typically patients are waiting less than 20 minutes to be seen in their express care.
That's amazing.
Another key to their success is that co-location. They're not only able to share resources like imaging equipment and staff, but patients are able to be triaged to a specialist right away if that specialist is available. This reduces further delays in care and gets them the appropriate orthopedic treatment they need when they need it.
They even have physical therapy co-located for one of their locations. It's just across the street. Even though their goal is to have patients see the physical therapist within about the 72-hour mark, sometimes patients get to see the PT the same day, which I think is really exciting for patients. And it helps build that patient loyalty buzz.
That makes a ton of sense. The Virtua Ortho Express model, they offer imaging, physical therapy. What other services do they offer under the Ortho Express care model?
They also do the casting and everything same day. That's something that is missed if you use a traditional all specialty urgent care model is you end up having to go somewhere else to an orthopedic office for your casting. You might walk out with a splint or something, but that permanent cast has to be fit somewhere else. They do share a DME technician with the clinic there, and that's a service that they want to continue to offer even if they do open a more standalone location.
At this juncture, how many Ortho Express locations does Virtua operate?
They're currently operating with 2 Ortho Express locations. Both are co-located with an orthopedic practice, but they have future plans for an additional 2 sites in the next few years as well. They're going to try to explore different operational models to see what works best for their system and the different locations throughout their service area.
I love that, Megan. Understanding the growth potential that exists here, that really speaks to the conversation in terms of pilot these offerings. You think about how you are really smart and efficient with co-locating these services, how you can flex your staff. And then from there, once you have the proof of concept, it becomes easier to make the business case for continuing to scale operations.
They have really put our mantra to pilot these strategic initiatives into place there, and it's been very successful for them. This is a program that they're very excited about, and I want to talk too about the downstream impact that they've seen by establishing these express cares.
In addition to co-locating with an orthopedic practice, both of their Ortho Express locations are also within 10 miles of a Virtua Health emergency department. This allows them to triage patients who may be lower acuity and send them over to Ortho Express for shorter wait times, being seen by the correct provider. With their talks with emergency medicine physicians and ED staff, they have seen a decrease in the volume of what we'll call fast-track orthopedic patients, so those who need casting, splinting, things like that. However, their overall overall emergency departments have not decreased at all. They've been able to maintain these volumes while still capturing those lower acuity orthopedic patients in Ortho Express. 35% of patients who do go to Ortho Express are new to the orthopedic practice. They're still able to utilize that as a new access point for patients into the practice and gain that downstream revenue through follow-up visits and further specialty visits as well.
So how exciting to think of those 35% of patients being new to the practice are also new imaging volumes, new physical therapy volumes, and hopefully become longtime patients of the orthopedic practice for future sports medicine related injuries or anything else they need.
You both just alluded to it. As you scale these operations, as you're able to bring in this increased patient count that is generating imaging diagnostic volumes, can you speak a bit to the impacts then on revenue that larger health systems are experiencing as a result of these sites of care?
Certainly that percent of new patients and the percent of referrals that you get for other services within your health system is going to vary. And what Virtua did really well is make sure they were set up to capture those volumes. So they have availability and capacity in their office for new patients. They have imaging availability. They have PT availability. You can't just open this and expect the growth to be automatic and the revenue to roll in, but you have to have all the pieces in place too, to make sure that if you do have a new patient, that new patient is able to get their physical therapy, their imaging and everything done within your system or have partnerships in place. Now, if you don't have office-based physical therapy program within your health system, that's okay too. But you want to make sure that the private groups that you're working with are also cycling back your patients to you once they finish that PT series, because we have seen how critical physical therapy is to patient loyalty in some of our data. We talked about this in the consumerism podcast we did a few months ago. We've hit on it in some of our webinars. But when patients use physical therapy, they end up spending more money over a 3-year period with your health system. And it's not just because they're repeatedly using physical therapy, but it's often related to surgical and chronic care that they need. So this is just serving as another front door for you. I think Virtua's example has illustrated that really well with the 35% of those express care patients being new to their practice. I think that's a great goal to have for any system that's putting this in place.
We've spoken a bit about the increased access that exists because of this care model, the increased patient satisfaction that is derived from that timely, available healthcare service that's being provided to this cohort of individuals. I'm curious, though, from a downstream care pathway perspective, is it your experience that we're able to get patients that enter the system through an Ortho Express type model, that it's then easier for them to access those follow-up services because of the existing care pathways that exist in terms of connecting them with PT and the other ancillary services?
Absolutely. That does depend, though, on the processes that you have in place for when new patients do come. Are you scheduling their PT visit for them? That would be a best practice. If they need off-site imaging that you might not have, if they need an MRI, are you scheduling it to make sure that they get it done at your facility? There is a patient navigation, care coordination element to this if you really want to optimize the patient journey within your health system.
This is guidance that we give health systems across any number of clinical programs. Make it easy for the patient to interact with your system. So instead of putting the onus on them to trigger those downstream events, how can you proactively manage their care episode and keep them within the system so that they don't leak out?
Exactly. And when we look at the consumer survey, we also ask questions about preferences for how our patients and consumers would interact with urgent care.
The survey showed that 45% of respondents said the top 2 most important factors when choosing an urgent care is proximity to their home as well as short wait times. So patients don't want to travel very far. They don't want to wait very long. And an orthopedic urgent care walk-in clinic is definitely a way that health systems can help to achieve this for their patients.
We are nothing but consistent in terms of wanting that instant gratification. This certainly helps us get one step closer and actually being able to provide that to our patients. As more health systems explore these models, what advice would you give leaders that are listening to today's podcast?
I would tell leaders to identify what gap they're trying to fill in their system with a model like this and how it aligns with their organizational strategy and goals, whether that be increasing access, offloading the ED or their traditional urgent care models, or even increasing their orthopedic volumes. Identify how an orthopedic walk-in or urgent care model can align with those goals, and that will really help inform the operational approach that systems will take, whether that looks like a walk-in clinic, a standalone facility, or what it may be. But that would be the first step to the planning process.
Yeah, and we've talked quite a lot about location and proximity today, because when you have an acute injury, especially, you don't want to be driving too far or make complicated journeys. So that is the next step for leaders. Virtua really emphasized how important this was for their market strategy as well. And they identified in their next iteration of this a market that they felt just was a little bit out of proximity for their other services to go to, and make this a really seamless triage process for patients too. Not just that initial contact with the system that's in a random location, but trying to group together services like how we've described. They have their office, their urgent care co-located, nearby is their physical therapy location or maybe advanced imaging. So that proximity is still really important. I know there's been times, at least in my planning career, where we seem to get away from this a little bit. Things have also shifted back to folks wanting things closer to work. For a few years post-pandemic, we really wanted things to be close to home. Now we're going back to the office again. So shifting a little bit around there. And then if you don't plan for this, is capacity to accommodate those new patients. So if you're expecting 35% new patients and you get to ramp up to that number, and then maybe you see a plateau once you've gotten some market standing there, where are they going to go? Are you going to be able to see them for their subsequent visits? If it's something more serious, does your PT have room to see them for their entire series? But also, especially our younger patients, they might not just have one orthopedic injury for their life of their amateur sports career or just their being a kid. So preparing for that is important, and knowing your patient. Virtua talked to us about the patients that they are comfortable seeing, and they actually see anyone over the age of 8 in this express care model. So something to keep in mind for staffing as well.
That's amazing. Donnelle, Megan, thank you so much for joining today and sharing your insights. Teeing up this ortho urgent care model illustrates how, when done right, the downstream impacts can be so powerful in terms of capturing those new patients, reducing emergency department burden, and then being a funnel for creating that long-term loyalty within a health system. Appreciate you joining the podcast today.
Thanks for having us.
Thank you.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at Sg2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, Sg2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You could find them at Vizient /podcasts. Have a great day.